After several years of planning and construction, the St. Regis Mohawk Tribe Health Services Clinic is moving into its final phase of expansion and renovation of 80% of its existing space. This will result in some temporary changes as the expansion moves towards completion.
Phase 4 is actually going to result in the change in the entrance to the health facility. But essentially the main entrance is going to be relocated to the east looking side of the expansion. So this on this side. This is going to be the main entrance. We're going to relocate, so you're going to come in, and because we're doing some major work within the existing primary entrance, and we just need the flow dwindled some so they can perfect the floor and things like that.
Other changes include the creation, enlargement, and temporary placement of essential spaces such as nurses' stations, exam rooms, and the pharmacy.
This sequential series of events that happen is we do have new exam rooms that are ready to be used. The pharmacy is really still in the same spot, but the access to it has changed. So the access to it is now farther down into the facility, so it's requiring a little more steps of our customers, the whole notifications of when your script is ready. We can't just holler out the window like we used to, and we're actually we're doing the texting. So when somebody drops off their script, we ask them their number, and so be it somewhere else in the facility or out and about, we're texting you to let you know when your script is ready. So kind of getting into the modern world, people have noticed a tremendous amount of space. We've at least doubled the space for pharmacy. That allows us to increase our formulary, increase our supplies, so that's going to reduce the process of ordering, hopefully on a daily basis, where gives us more time and more inventory, and then more workspace.
The lab and waiting room will also see noticeable expansions, creating a more efficient workspace and a more comfortable visit.
The lab, the same thing. The lab is operational. They've got more space to spread out for the services, so it's more comfortable for the staff, as well as our customers, where we got a lot of space there to come in and do our lab draws. The other area that we're working on that's part of Phase 3 and Phase 4 is the new waiting area. There's going to be, that's the completion of that is Phase 4. The waiting area is where we're increasing the area for medical reception, again adding a couple more exam rooms, and again for more efficiency.
With such a logistical undertaking and an initial project cost slated at $7 million and some minor adjustments with design, the projected finish date has adapted accordingly.
On paper, the finish date was December 31st. I haven't heard an official date, but reality tells us to have it done before February 1st is going to be a challenge. How's it looking? Is it going to meet our needs? There's no question. We are already reaping the benefits of additional space, meeting areas, office space. We have a lot of space here, and it was well designed. I'm quite content with how it's all developing. But the support of the council is certainly has been consistent, especially with giving us the leeway to determine for ourselves what's best for our program, which means what's best for our community.
And finally, the demolition of the old tribal building will create much needed space as the clinic increases its capacity for service.
The benefit of that to us, and us being the health program, is that the traffic patterns, it's not a safe off and on process with Route 37. And so that's going to help us with additional parking. But right now, the absence of that building is certainly going to benefit parking for our staff, so we can have the customers have priority parking closer to the building.